Fantastic. Thank you, Mr. Chair. And I want to thank our witnesses for being here today. This is a very important topic. And I think that this is something that a lot of families have benefited from. So in your report, Ms. Hogan, you highlighted the fact that there was a risk of not getting the space creation. Are you confident, based on the information you were able to assess, that all of the spaces that were created were net new spaces?
Mm-hmm. So, that was a challenge, and that's why we talk about it being a risk, that the target of 250,000 new spaces won't be met. The federal government just has the information that's provided to it by provinces and territories, and there isn't clear parameters on exactly what to report back. There could be some that are not net new. There could be some that are created that just not used or taken up because there isn't staff for those spaces to be created. And I think this speaks to one of our key recommendations is why better gathering of data to be able to compare across the country, apples to apples, is definitely needed. But when we look at how many spaces were created in year 3, while I recognize it's likely going to be back-end loaded, there's a lot of work left to be done.
Well, like I know in my province of Alberta, there were day homes, and a lot of them were unregulated. And so basically, we created regulated spaces, which an unregulated day home could have 5 kids, a regulated day home can have 6. So that's a creation of one space. But I believe in this agreement, and perhaps Mr. Thompson, you could give us some information on this. Did that count as 6 spaces or 1 space in a situation like that?
Catherine, do you want to?
So if, in that case of a private home care provider, if they moved into the Canada-wide early learning and childcare system and added a new space, I believe that would be counted as 6 new spaces created because they're coming into the Canada-wide system. And by that, they're then abiding by the guidelines that the province has agreed to around affordability.
So then, Ms. Hogan, I guess this opens up a big question of like, if that's the case, that there were already 5 spaces, and by moving them from one system into another system, now they count them as 6 new spaces, but technically there were 5 spaces. Is that not like really funky math?
So I think it's important to step back and say, childcare is regulated by the provinces, and then there is unregulated spaces and regulated spaces. And all the federal government can gain access to is information on regulated spaces. And so there are certain rules, and you're going to have certain rigor and improving quality. And the goal of this program was to increase affordable quality, flexible spaces. And so, yes, it would be bringing in new spaces. I agree if I was a parent, I would say, well, there isn't 6 new spaces there, right? And I think that's one of the biggest challenges of being able to show whether or not this funding is really meeting the net objective of creating 50,000 new spaces, right?
So then my next question is, in your report, you talked about the fact that there were provinces that were using school-aged kids. Can you elaborate on which province or provinces were using school-aged children as part of their counts?
So there was, we mentioned that about one province. I believe it was the province of Saskatchewan. And I think in this case, what they were told was the space is occupied by someone over the age of 6, but eventually when that person is no longer in that space, we'll redirect it. But this is why you need to set out the parameters with provinces and territories at the outset. What are we going to count? What are we all going to agree is a new space under this program, so that you're reporting accurate and comparable information nationally.
Well, and I think that's so critically important. And I'm a parent of 2 young kids. I've got a 4-year-old and a 2.5-year-old, and we rely on childcare. And I think a lot of parents feel completely gaslit because they have access to waitlist. They don't actually have access to childcare in so many provinces across this country. And the federal government goes out and says, this is such a huge success. We've done such an amazing job. We've created all these spaces. And they're sitting there going, no, this day home that I used to go to, it's it's just now regulated, and so there's one more space. That's not 6 new spaces, that's 1 new space. And when we hear things like some provinces are using that because the information from the federal government wasn't clear, well, perhaps this was a case where the federal government should have left provincial jurisdiction alone and worked with provinces to create a program rather than imposing a program on a province, but that's just my little soapbox that I'll get off of. So my question on the Saskatchewan piece, how many students were counted in that?
So I'm going to have to see if someone can give us that level of detail. I think the only comment I would make as they're searching for that information would be that the agreement to develop the Canada-wide early learning was a collaborative agreement. So provinces and territories contributed to what the 5 goals would be. And one of the conditions of accessing funding federally would be to provide information. And all I can point out is that the federal government should have set themselves up better to get comparable and consistent information. So I'm just going to see if someone can give you that answer.
I want to.
Do you want that answer?
One more quick question on this. Are we also counting how many spaces closed as a result of this? Are we tracking any of that?
And Ms. Goodrich's time is up. I will let you answer both those questions if you like. Thank you.
You're not on.
Oh, I have to press it myself?
Yes.
Okay, thank you for the question. So very briefly, it comes down to the wording in the agreements, and some agreements specified that the space creation targets were net new, and some did not specify. So the measurement of what was reported against those objectives can kind of be a mixed bag of things. And for the Saskatchewan example, it was an estimated number of spaces because about a quarter of the family home spaces in Saskatchewan are for school-age children. So that shouldn't have been counted, depending on how you define the parameters of new space creation. Thank you.
Thank you very much.
Chair, and thank you to our witnesses for being here today. Ms. Hogan, your report showed that between 2020 and 2023, the number of parents who reported difficulty finding care for their children had increased by more than 30%. This difficulty came after the program had commenced. My colleague had provided his insight as to why he thinks this might possibly have been, but I wanted to ask you directly, why do you think that this occurred, this dramatic increase after the commencement of the program?
Well, I mean, I can simply speculate here because the federal government hadn't really gathered information about whether the new spaces were actually being used or not used and what were the root causes. In fact, they went to Statistics Canada in order to go get that. I think I would start off by saying that when you raise costs, obviously increased demand is going to be there. And that Statistics Canada survey did highlight that many people were saying that the new spaces created either didn't meet the needs of their children if they had special needs, that the timing didn't fit their work schedule, or that the space wasn't available in their community. So I think this speaks to the need of having the provinces provide information federally so that they can have a better picture about it's not simply about creating spaces, but it's about creating them where the need exists and helping influence how that can be so that you can speak nationally to whether or not it's meeting the needs of families.
Thank you, Ms. Hogan. And with that, I'll go to Mr. Thompson. As the Auditor General indicated, outside of Statistics Canada, your department didn't properly track or assess data. Can you tell us, please, how many families are currently on wait lists?
That, unfortunately, is a data gap in the system. Provinces do not maintain, most provinces do not maintain centralized waiting lists. So the individual providers would have their individual wait lists, but that would include duplication of a lot of names. So this is one of a number of issues that where we fully agree with the AG's recommendations, and we have work underway with provinces to provide better reporting. In fact, we've just launched a portal a week ago, which will provide more timely and accurate information on the progress being made in space creation. And we're going to continue to work with provinces as they upgrade their ability to report to citizens within each province and territory.
Ms. Hogan, do you believe if the government was following through on its own agreements and ensuring the guiding principles were being met, that wait list would be shrinking and not growing by 32%, as you noted. We're hearing about the will to have these things, but are the things, should the government have included within the agreements more benchmarks, if you will, or anchors, as we've come to call them financially, to ensure that the spaces are being created in an effort to receive the funding?
I mean, I think that's one of, we issued 3 recommendations, and that's probably one of the most key ones, right? If you want to be able to show that Canadian funds met the objectives of this program, you should set yourself up at the front end to gather all that information. And there are some really important gaps. The agreements call for that kind of information sharing. So now you need to sit down with the provinces and territories. There needs to be will on both sides to be able to gather, ability to gather, and then willingness to share. But then when the federal government does get it, so in some cases we see they're not getting some information, but when they are getting the information, they're not consolidating it in order to give a global portrait for what they might already have. So I think there's some work to be done on both sides, but this is something that should be thought of at the start of the creation of a program. What do we want to measure and how do we plan on getting there? But also making sure that you have certain milestones a few years in order to show progress so that you can keep pushing towards the ultimate goal.
Yeah, I would go so far as to say that perhaps the disbursement of funds should be contingent upon these types of things. But again, I just find this completely ironic on the day that we were supposed to hear the announcement of an MOU with my province, the lack of details which surround these things. And this is, in fact, one of the flagship pieces of this government, which is, of course, the continuity of Prime Minister Trudeau. And so what I'm hearing you say, which is consistent with what they have done and what I expect they will do today, is just sort of announce things, put things in place without really doing the hard work of determining the data, the necessity, the requirements for implementation, or as we've seen here with ESDC, the follow-up for it. Ms. Hogan, you mentioned that we're seeing parents who work shift work or live in rural, remote communities not being offered limited opportunities. Pardon me, I'll turn this to Mr. Thompson. What concrete actions have you taken to make the program more accessible and more open to parents that don't work 9 to 5 in an urban center, please?
Well, this is an objective that the provinces have signed off on to make a service offering that is responsive to the needs in their own jurisdiction. So obviously the federal government doesn't determine the allocation within a province to different centres. This is certainly a known area with our provincial colleagues, and they're endeavouring to try to make that type of service available, but it's really outside of the federal government's authority to allocate specifically within a province to meet those specific needs, but there's a shared objective to do so.
Thank you. That is your time.
Thank you very much, Mr. Chair, and welcome to our witnesses. I would like to thank you, all of you, for the quality of your French. I congratulate you. Mr. Lemire, I'm sure, would join me in my saying so. Ms. Hogan, there is a sentence in your report that we see very often in your reports. We have noted that the provincial governments and territorial governments, with the exception of the government of Quebec, etc., precisely in this instance, because Quebec has had its agreement in place for about 30 years now. And as Mr. Lemire pointed out, it was created in 97, and then Ms. Freeland moved it on a federal level. But it is a program that could be provincial, 100% provincial, and could be administered by the provinces themselves. Why not? Well, I think it's quite clear that early childhood education and childcare is a program administered by the provinces. It's very clear, of course, that the federal program is coming from a very different place than the other provincial programs. But for most of the country, it was very necessary because of the higher cost of paying for the spaces. Yes. there was a federal transfer, if you like, to the provinces of funding, but it is up to the provinces to account for that money. So it's difficult for us to say if there was improvement because of federal funding or not. But the fact is, Quebec has a structure which is very different from the other provinces of the country. On paragraph 18, page 12, you say that we haven't determined for the costs for the government of Quebec because there's no requirement for an annual report with respect to the federal funding. So, from ocean to ocean, it can be different. I've never been somebody who wants one size fits all. I think it should be drawn, inspiration should be drawn from the best practices, not just for the provinces, but for the sectors as well. For example, the CPE at Saint-Urbain in Montreal, Quebec, the requirements are different for what type of system is found in the regions of Quebec. So what best practice, Ms. Hogan, can you recommend that could be put in place and could be applied for spaces in childcare systems? I think my colleagues are probably better placed to answer that, but I can tell you that from coast to coast, it is very different. It's individuality, the individuality and the needs of each province is recognized in the agreements. Is it because it's a best practice, or is it just the way they operate? I think the reality really is different from province to province in each province. I don't know if there's anybody who'd like to add anything, but we really didn't approach a review of the agreements from that perspective. There are 5 targets in the legislation, how the government is going to provide accountability to Canadians about the way in which they spent the money, and also the net new spaces. In some provinces, that was the case, and not the case in other provinces. So I think there are some measures that could be corrected to have more consistent and uniform practices throughout the country. So we can say that we created the 250,000 new spaces in Canada. Yes, but is it an intrusion by the federal government in each province and territory, or is it just something that is indicated to help the provinces? Mr. Lemire might say one thing, I would say another. The way I see it is that there's a Canadian daily reality. No matter what province you live in, people who live in cities can drop the kids off at a space that is on their way to work. But when you are in a rural environment, it's quite different. I live there, and there are people that are very happy to live there. But in the suburbs or in the city center, in the core of the city, it is very different. And Mr. Dutel, question. How do you reconcile these differing realities to help people? That's where the flexibility comes in. They can decide, people can decide where the province creates the new spaces. It is up to the provinces. It's not the federal government that's going to make that decision. There are different needs if it's in a rural or an urban area.
Thank you, Mr. Chair. One of the pieces that I think is the most flawed in this system is the fact that the federal government really limited the amount of spaces available to entrepreneurs. Specifically in my home province of Alberta, you put caps so that we couldn't expand childcare. And so that has meant that childcare operators are primarily women, so women entrepreneurs have been left out and are sitting there struggling. And this means that families don't have access to care because these programs, we have childcare spaces that are existing, but they're not able to access this grant because of arbitrary caps put on by the federal government. And so why was there such a focus on limiting access to these spectacular female entrepreneurs in expanding these businesses that already existed in many cases?
That's
to you, Mr. Thompson.
Yeah. Okay. just checking. Thank you for the question. On the for-profit sector, it was certainly the policy intent of this investment to support the expansion primarily of the not-for-profit sector. There was not a prohibition on expanding the for-profit sector. It was
put caps in place, very strict caps.
The policy objective was that the not-for-profit sector should grow at a faster rate than the for-profit sector with the investment. So both could grow, but the ratio is expected to shift more heavily towards not-for-profit. That was the policy objective. I would make two other observations. One, home operators were excluded from the definition of for-profit. So if you're operating out of your home, you're not considered for-profit.
If you have a really small business, you're excluded. But if you have like a 30-kid daycare and have a few employees, that's the problem. But let's have these big, giant, not-for-profit daycares in large centers. That's A-okay. But like the part that really hits me hard is I live in a rural community. I represent a rural riding. We're not talking about large centers by and large. We're talking about small centers. And those small centers are generally served by owner-operators. And your guys' systems completely left those out. And that, to me, is a huge issue. And then I think one of the other pieces that I want to hit on is I'm incredibly proud to represent Fort Wayne Cold Lake and the amazing men and women that serve in the Canadian Armed Forces there. The child care deals, as they are currently written, do not meet the flexibility requirements to serve the parents that have children that are serving our country, serving our national security needs, because they don't typically work Monday to Friday, 9 to 5, and they often need outside care. And these deals have left these families in Cold Lake completely out in the cold. So what is your government doing to make sure that families that are serving our country are actually able to get the flexible care they desperately need?
So a few points on that. First of all, as I said, there's no prohibition on for-profit expansion. It can be done. And there's nothing to stop provinces from making additional events.
That's not accurate because in my province of Alberta, they are actually limited in
ratio.
Yeah, there's a ratio. So you have limited the number of spaces that can be created because you guys have set an arbitrary number, not understanding the reality on the ground in Alberta.
But that ratio only applies to the federal investment. As I mentioned, provinces have invested quite significantly in this as well, and
I'm very proud of my province of Alberta for stepping up when the federal government decided to set arbitrary limits
to make that investment as well, and they are making that investment. The latitude for private operators also includes, and this is a consensus amongst provinces and territories, looking at the guardrails, making sure you got financial controls that need to be a bit more robust in the case of private operators. Quality assurances.
That's really frustrating to these operators that are stuck in these systems that inflation that's been out of control has hit them hard, and they are struggling to make ends meet. And you guys continue blaming these amazing female entrepreneurs, these owner-operators, and to me, that's absolutely not okay. And I will stand up against this every single day. Ms. Hogan, could you perhaps explain to us how flexibility is being measured, and are they actually meeting the needs of these parents that need outside care? Because I know in your report, it very clearly states that there are not guardrails in place to make sure that the flexible care is being met.
Mm-hmm. Many of your questions point to policy choices, and those are not things that, as you know, that my office will comment on. We comment on the implementation of the policy choice that have been made. When it came to flexibility, again, I think it's an area where there was very little parameters put out for the government to be able to report back on flexibility. And I think it was just given to the provinces as saying, you understand your needs and you set them, and there there were certain criteria, as the Deputy Minister talked about, around increasing regulated spaces in the not-for-profit sector, which were policy choices that had been made. And the rest of the flexibility about where funding went specifically was left with the provinces to make.
I'm afraid that is your time.
Madame Hogan, vous avez parlé des risques spécifiques selon les...
As though the government has met their guiding principles with this program or not?
Audit showed that the federal funding led to improvements. I think the most noticeable would be in affordability. There's definitely been a decline in the costs for childcare per day, and there's definitely been a creation of spaces. But what's missing is whether or not the government by the end of 2026 will be able to show that all of those goals have been missing because there's gaps in information. So there's a failure in making sure that you've set yourself up to get that information, but it's clear that the funding has helped make childcare more affordable across the country.
Okay. In your view, do you believe ESDC has properly tracked and kept data to assess whether or not the government will meet its guiding principles?
I believe most of our testimony today has been around exactly that, a gap missing. There's a key recommendation about gathering better information. I think when it's easier to track number of spaces, it's hard to know whether they're being used. It's hard to know whether they're inclusive, whether they're being, the right families are using those spaces. So I think there's a lot of opportunity for improvement on data gathering and reporting.
Is there any other program that has been created and implemented by this government that you could use as a comparison, or alternatively a principle of IFSR that would be applicable here in terms of the fund delivery for the outcome?
Oh, I mean, that's a very difficult question for me to look at. There are so many programs across the government, and I think this is, I think some of the findings that we're finding here about the need to establish how to measure when you're in a space where it's regulated by a province. We're seeing that in other programs. We saw it in gathering health information during the pandemic. You see it in housing. So I think there needs to be a way for the federal government to work out better reporting and exchange mechanisms with the provinces and territories, because often there is a commingling of federal money, provincial money, municipal money, and how do we talk to Canadians about a program on a national level when you don't have good information sharing agreements for all of these programs. So I think there's an opportunity for all levels of government to be able to show Canadians how money's being spent in a better way.
I agree, and in addition to the example I gave earlier about the pipeline MOU, which is supposed to be announced today, I'm actually thinking of another example within my city, specifically that the government is going to withhold funding for housing should they decide to repeal the blanket rezoning. So it's really, it comes with strings attached. It's not, this is for the good of your community and what you decide. It has to adhere to things. In 3 instances, you note the Employment and Social Development Canada, either did not effectively assess or mislead opportunities to monitor expected outcomes of the program. Why do you think that is?
Again, it speaks to that recommendation around not, at the design of this, really thinking about how to gather comparable and consistent information across the country, recognizing that everybody was starting in a slightly different place. So how do you elevate it to be able to talk consistently? And I think it's just not having that data, and at times collecting some of that data, but then not consolidating it to talk about the global picture that they have. So I think there's 2 elements that contribute to not being able to demonstrate.
Do you believe that ESDC has the tools to monitor these arrangements currently?
Well, all of the agreements clearly call for the exchange of information. And as was mentioned earlier, there is an annual report that's required, and funding can be delayed until that report is received. And we definitely saw that happening. But I think the focus needs to be is on the content of what's in there, so that you can get some more consistent and comparable information from all the provinces to speak nationally about the program.
Why would you think that the government signed individual agreements with provinces and territories, knowing the areas they wanted to track, without receiving guarantees that they would be able to receive that information from the provinces and territories? That's tied into my first round.
Oh, well, I think all of the agreements talked about the need to exchange information, but it wasn't to the level of exactly what. And I think some of the agreements recognized, and we had a conversation just earlier from another question saying, provide information if able, recognizing that some provinces just didn't have the robustness or the maturity of a system right now. And how do you support them in getting that so that you can get national information? So I think there's a lot of parameters in place. But this is possibly an area that we see in many programs, right? Forgetting to think about exactly what we need to show outcomes. It's not just about metrics, right? It's about really the end game. And I think inclusivity and flexibility are great things. It's easy to measure number of spaces, hard to measure something that's a little less concrete, right? And so you have to think that through at the start.
Thank you very much. I just have a quick comment, since it's come up and something that you could look into. The daycare, the child care facility for national defense here in Ottawa, my wife's in the forces, it's not located at the D&D HQ. One thing our personnel does not do is complain. So I'm going to complain on their behalf today. Daycare has to be located where the men and women who lace up their boots every morning to defend this country go to work. There's no point putting it halfway across town when the men and women then have to drive almost to Canada to go to work every single day. So I'll leave that with you, Mr. Thompson, to raise with the CDS or whoever your counterpart is on the military side. Location is key, which I know my colleague Ms. Goodrich will agree with. And on that note, Ms. Goodrich, you have the floor for 5 minutes, please.
Thank you. And I think this is one of the big struggles that we are facing. But one of the questions I have, I know Ontario put out their Auditor General report where they highlight the fact that 27% of the spaces that are created are not being filled. So are we, Mr. Thompson, do you know how many spaces across the country aren't being filled that have been created?
I don't have perfect data on utilization rates. It would vary from province to province. This has been a discussion with Ontario on their utilization rates, since it was fairly well documented in the Ontario Auditor General report. So they have commitments that will be part of the extension agreement, not only a space creation, but also a utilization commitment.
Well, and I think this is the part that really frustrates a lot of parents. We have thousands of parents that I've talked to that are waiting on lists. They have no availability to any kind of flexible, affordable, any kind of care. They take the first care that's available because they've been waiting on lists for so long that there is no what works for their family. They're literally taking the only thing that they can get. And oftentimes it's not what works for their family. And then to hear that there are spaces being created and that aren't being filled is infuriating. So what things other than we don't have the data are you guys actually taking action on to make sure that spaces are being matched to the people that need them?
Yeah. So I would say the action plans that are done with the province need a complementary workforce plan. One of the major constraints to space creation is the availability of early childhood educators. I mentioned we've seen significant growth, 30%. I don't think that is sufficient yet to meet the goals that we have. So there's further growth of the early childhood educator space. It's being encouraged by the wage growth, the wage grids that exist. That's a big way of attracting more people in. But I would say that's one of the biggest barriers to utilization, is ensuring you've got sufficient staff to run a childcare facility.
Well, but I think it's also making sure that the facility is being built in a place where the needs actually are. Has there been any kind of needs assessment as to which communities have childcare deserts? We know that there are places that have childcare deserts, and I'm going to go on the record here saying Cold Lake, Alberta, the home of Four Wing, Canada's premier air base, is a desert when it comes to childcare. We have families that are serving our armed forces that cannot find care. I'm not bringing this up because I'm the member of Parliament for Fort McMurray Cold Lake. I'm bringing this up because this is absolutely atrocious. And we do not have flexible childcare. We do not have childcare available outside of Monday to Friday, 8 to 5 in that community. How are we asking fighter pilots that are going on deployment all across? And this is just one example. There are hundreds of examples at bases all across this country. How are we not providing flexible care so that these people that are put in isolated postings, away from their family, away from their support structures, have access to the care they need?
So I noted the significant investments D&D is making in collaborating to designing a responsive.
Haven't made. So families right now, today, are making impossible decisions because we have been 3 years into this, and they're only just now maybe starting to think about this.
Well, I was going to finish my answer and note that the current agreements encourage the creation of spaces that meet the community needs. That's up to the provinces to decide in their action plans. Where they're encouraged to do that, we would welcome it in action plans if they were to respond to those needs. And the last thing I would say, I wouldn't interpret a low utilization rate to be a sign of no demand in that community. It's more often a case of insufficient staffing to keep the space open. So it's constraints like that that are leading to a low utilization rate.
I appreciate
rather than the absence of demand in that area.
But you don't have the data to actually tell you which ones are because there's low staffing and which ones are because there's just no need. We also don't have any of this data. Like we're going off of StatsCan data. Your department doesn't collect any of this. That seems like there's a huge gap there. The fact that there is no space, like we know some parents that are on hundreds of wait lists and they still can't get in. There is no flexible care. I know families that are choosing other childcare forms simply because the only childcare available in their community is not flexible enough for the needs so that they can actually do the job. That's a problem. That is a huge problem. And so I think the next question, we know that it costs more money to provide care to children that have different needs and special needs. What is being done to ensure that low-income and special needs kids actually can get those care?
That too would be an element to prioritize in action plans. I don't know, Catherine, if you want to elaborate on how those needs are reflected in the agreements.
Yep, we do ask that there be with each agreement every year an action plan that the provinces do to demonstrate what they're going to allocate to space creation, what they're going to prioritize in terms of spaces in childcare deserts, inclusion of low-income families, being able to look at where there's high-need areas, socioeconomic demographics, to be able to determine where they will want to incent, build, create spaces. So every province does do that in their action plans that they provide to us to be able to demonstrate what their plan is to do with the money for the year. It's a really important piece that I would say I've heard from every province and territory, being able to make sure that they are able to meet need. There are no doubt challenges. Rural areas can be challenged for the creation of spaces. They're more expensive quite often. It's also in large city centers where rent for a childcare facility can be higher. So there's always these balances that provinces are looking at making. There are challenges that you've raised that are well acknowledged, and I would say all my discussions with provinces and territories validate that they are looking at how they can improve this.
Thank you.
Did you have a closure, Liza? Are you Ms. Goodrich, you have a last comment?
Well, I think it's good to hear that you guys acknowledge this, but it sounds like you aren't actually doing things to help the families that are struggling right now, and you're putting a lot of blame on provinces when you guys created a system and didn't actually create the metrics to be able to tell parents what was going on. That seems like a massive flaw to create a system without actually having any metrics for measurement. Can you commit that you'll do better in future agreements and things where you're stepping into provincial jurisdiction?
Order. If you like last comment, then I'll move on to our next witness.
I think I've stated our commitment to do better on data reporting, also noting that I think we have some meaningful indicators already, 125,000 new spaces created as of November, and very significant evidence on the affordability side, but fully accept the responsibility for bringing more granularity and more precision to some of the broader objectives of the program. Absolutely.